Welcome to Virginia Medical Updates. Thank you for joining us today. My name is Alejandra Gonsalves, and our topic for today is cardiovascular disease risks and prevention. Today we have with us our very own Dr. Madhu Henry. Dr. Henry has 14 years of experience as a primary care physician. She studied at George Washington University. And thank you, Dr. Henry, for joining us today.
Thank you, Alejandra. I'm going to start with a quote. One of the first duties of the physician is to educate the masses not to take medicine. Soap and water and common sense are the best disinfectants, by William Osler.
I like that. Making sure that patients have some common sense and keeping it simple with soap and water is a great thing for patients who are, not worried about all the medical terms that you have to think about. But tell us, how is it that you are so interested in this topic that we're discussing today, the cardiovascular disease?
Great question. I have a personal desire, or I came to medicine with a personal desire to educate and form relationships. I honestly believe that allowing, taking medical knowledge, lingo, and translating into layman's terms seems to forge more of a trusting relationship. And it also makes medicine and health maintenance doable, achievable. My interest in cardiovascular disease is because it's preventable, and a lot of the basis of prevention is education.
Okay, so if you're saying it's preventable, then what is it that we could do as patients to not get this disease?
Sure. Cardiovascular disease, the most common causes, the common risks are all areas that we have choice in: diet, exercise, weight, alcohol consumption, smoking. These are all preventable, and with the proper education and the proper relationship, areas that we could modify.
Of course, yes. Mm-hmm. So if it's something, I know that it's very pervasive in the United States, cardiovascular disease, and it may be that maybe we're just lacking what it is that causes it.
Sure.
Do you have more information on that you can elaborate on?
Sure. Actually, since 1975, cardiovascular disease has still been a leading cause of death and disability within the United States. I think that the best place to start when you kind of open the discussion is a definition. Because I think, again, here, cardiovascular disease, what does it mean?
Right.
Is it the heart? What are we talking about? So I think the best way to approach it is to make it simple. Cardiovascular disease is defined by coronary heart disease, stroke, and peripheral artery disease. Coronary heart disease is, in layman's terms, a heart attack, an MI. It's a blood clot or an aneurysm in the heart.
Okay.
A stroke is, in medical terms, a CVA, cerebral vascular event, or a transient ischemic attack. But for patients, that's a stroke or a aneurysm in the brain. And peripheral artery disease is the same thing. It's a blood clot down in the leg or in the lung, so it's in an organ.
Okay, so essentially cardiovascular disease is a blood clot either in your heart, your brain, or somewhere else in your body.
Exactly. That's the simplest way to look at it. The other thing that's important to think about this is, unlike in television or in the movies, people don't survive these events. A heart attack, you die. A stroke, there's usually a devastating consequence. There can be a paralysis or a life-changing event. So my passion comes from the idea that it's preventable. We can do things to change the outcome.
Right. And I know that the American Heart Association is big on trying to educate people on the prevention, and they have a big push that they have, or a big campaign that they have with the red dress for women. Is there any difference for women when they present with heart attack symptoms?
Yes, absolutely. And that's, again, a quote that really, I think, augments or highlights what you're saying. The most common way women present with heart disease is dead on arrival. And it shows that in most cases, women aren't even aware they have cardiovascular disease. They're not aware that they might be suffering from some event or some disease process that will likely take their life. So it is really important to take this specific patient population and educate them further about how they do present.
And so for women then, if it is such an issue with the heart health, are there different symptoms that they may present with versus men? For a heart attack that we should know about?
Absolutely. I think it's very commonly known when you think about a heart attack, you think about tightness,
right, your
chest
arm
pain and pressure, exactly, your left arm pain and jaw pain. But when you talk to women, and we do studies and we look back at how they were feeling, possibly months prior to presentation, the top symptoms that come forward are pain or ache in the upper back, jaw or neck, shortness of breath. Many women will present with flu-like symptoms, nausea, vomiting, cold sweats, a feeling of anxiety, a loss of appetite or discomfort, general discomfort. Many times upper abdominal pain, epigastric pain. It could be mistaken for reflux or heartburn, very common.
So many different symptoms that we could have, and really it just shows the importance of having a great relationship with the doctor and making sure that you have these discussions and making your appointments if you're not feeling well.
Absolutely. I think I highlight the idea that at the annual exam or preventative screening exams, many of these questions are brought to light, especially when we are dealing with the different patient populations, focusing on these types of questions and expanding or elaborating on it at that time. The other one I wanted to mention, because we did talk about stroke, is there's an acronym out there to kind of help patients recognize and to act fast.
Okay, great.
And that's exactly, the acronym is FAST.
FAST, okay.
It's to recognize a stroke. We use the F for face to see if there's any facial drooping or a smile that seems like it's asymmetrical. A for arms, does one arm drift or fall downwards? S for speech, is there any unrecognizable, garbled, slurry speech? And T for timing, if these are seen, we ask that family members act very quickly, very fast, and call 911. These are signs of stroke.
Okay. Yeah, I think that's really important. Probably something that we should all be aware of, not just within the family, even at work. You could help one of your coworkers, getting them to the ER in a timely fashion to help them out.
Exactly.
But I know you said that this is a preventable disease, and talk to us about what can be done a little bit more in order to avoid having this.
Sure. So there was this very big study called done by Inner Heart. It studied 52 countries around the world, and it showed, after taking into account all these risk factors, that there were 9 modifiable risk factors seen in 90% of first-time heart attacks. I mean, that's unbelievable, actually, if you think about it.
That's a lot of chances to be able to stop the disease.
Exactly.
Yes.
So I just wanted to highlight them, and then we could take some time and maybe explore upon them.
Okay.
But diet, smoking, hypertension, dyslipidemia or cholesterol management, physical inactivity, obesity, diabetes, which is in many cases considered actually a cardiovascular event, heavy alcohol use, and psychological or psychosocial factors. This is kind of the first time where stress has been brought forth with the medical community and acknowledged and recognized as something that could lead to a heart attack. And I think most commonly in my practice, I'll have patients come in and claim they're under a lot of stress. Could that lead to a heart attack, doc? And I've heard over the course of training and years, oh, no, no, no. But now we've actually shown through studies, we've proven it, that yes, stress does lead to the different events that can lead to a heart attack.
And so these 9 factors, this is something, as we discussed before, that during the annual physical exam you would touch on with the patient while they're in your office.
Exactly. I think that in a screening, annual physical and so forth, we're doing both a history where we're able to factor in the patient's complaints, their family and genetics, their social history where we talk about smoking and alcohol consumption. And we're also given that opportunity to forge a relationship and kind of stick in here. Here's some areas where you could make some changes. We also take blood work. So we are looking at things like cholesterol and diabetes and so forth.
That's really important, I think, spending the time and making sure that patients get in there annually to make sure that even if they're not feeling like they have those symptoms, that maybe they just don't know that it's a back pain, as you mentioned, or upper abdominal pain, and it could lead to having the disease.
Right.
So is it something that has been, like you said, the diet is so important that patients would be able to make that change?
Sure. And I thought now would be a good time to kind of focus on diet, since I gave you a list of 9, and that's a lot to talk about in one occasion or one sitting. But focusing on diet is something that not just the medical community, the community wide has started to focus on. The amount of availability of different grocery stores, the more vitamins and nutrition therapy that's out there. Even our colleagues and counterparts like chiropractors and naturalists have come into this area of trying to attack cardiovascular disease with education through a healthy diet. We have many studies to prove that diet can truly make a difference.
So it seems, Dr. Henry, that these 9 points are something, as we discussed that earlier with the physical exam. Would you be touching on those points during that time with the patient?
Absolutely. We screen for these issues and make recommendations based upon modifiable risks. I like to simplify this by presenting it in a concept similar to smoking, alcohol, inadequate physical activity can all lead to obesity, while dyslipidemia, hypertension, and diabetes can all be managed in some extent by diet. The potential benefits for the primary prevention strategies have been hypothesized in many different studies and have been proven. There's a large study by a nurses' health, it's called the Nurses' Health Study, and it studied 120,000 female medical providers, and it showed an 84% risk reduction in women who observed dietary changes. They did not smoke and they did not drink alcohol for 20 years.
Wow.
84% risk reduction.
That's really big.
Yeah, and then there was a women's health study that similarly studied 40,000 women and showed it was a shorter course of period of time, but they showed a 2.5% risk reduction in the first cardiac event. So very large and compelling reasons to take diet on.
Right, okay.
And so to that, I would say a healthy diet, what we've kind of as summarized as a point would be that fruits and vegetables compose the primary bulk of your diet, fibers including cereals, foods with a low glycemic index or low glycemic load. And what this means is there are foods out there that raise or spike blood sugar. The body does better with soluble fibers or foods that don't contribute to this. So in old world medicine, we used to call that the starches or carbohydrates. Nowadays, we have started to get a little more sophisticated in the way the nutritionists and, like I mentioned earlier, grocery stores advertise this. But to simplify it, it's your stock vegetables, things like broccoli, Brussels sprouts, cauliflower, grains, quinoa, oatmeal.
So those are all the healthy things that we should be looking for.
Exactly. They don't seem to have that high glycemic index. In addition, we started to do many studies and again, consumer-driven changes to avoid to continue to eat monosaturated fats and to avoid trans fatty acids or saturated fats. And again, this is the omega fatty acids, which are seen in fish and nuts, avocado, plant sources, and supplements.
Okay, great. So it seems as if we should lean more towards fruits and vegetables, try to not have as much meat and dairy, and exercise. I know you mentioned staying active is really important. So thank you again, Dr. Henry, for being with us today.
Thank you, Alejandra. It was my pleasure. I truly enjoyed the discussion, and I look forward to continuing it in the future.
Yes, hopefully we'll have you back again soon. And thank you, everyone, for joining us today. This has been Virginia Medical Updates. My name's Alejandra Gonsalves, and we hope to see you again soon.